Hi, I'm Dr. Michael Silverstein from Carnegie Women's Health, and I'd like to talk to you a little bit today about ovarian cancer. Fortunately, one of the less common gynecologic malignancies as compared to uterine and cervical, but one of the more lethal malignancies, especially compared to the other two. And that's largely because of the late diagnosis. So being in a part of the body that doesn't present itself until it's widely spread, similar to brain cancer, similar to lung cancer, similar to pancreatic cancer, it's often a late diagnosis. There really aren't effective tools for screening for ovarian cancer. In the absence of a family history, in the absence of a genetic predisposition, there are lots of things that are protective for ovarian cancer. Clearly, any time you've been on birth control pills will give you a lifetime reduction in the incidence of ovarian cancer. And there are studies that have women who are at risk of ovary cancer who aren't even sexually active taking birth control pills because of its effectiveness at reducing the incidence. Clearly, identifying familial links, identifying genetic connections can determine whether you're at greater risk or baseline risk of developing ovary cancer. Several other features, such as interrupted ovulation by either parenting or birth control pills, can both have protective effects for ovarian cancer. In exclusively patients that have the familial link, there are many studies, especially in the New York City area, that enroll women in studies that involve ultrasounds and blood work and frequent visits that screen for incidence of ovary cancer. But using this rationale for baseline incidence of ovary cancer may drive more women to have surgeries and could potentially cause more harm than good with the number of surgeries they would do unnecessarily as opposed to the surgeries they would do to reduce the incidence of ovary cancer. Clearly, a woman's life can be prolonged with very simple regular pap smears, annual mammograms after 40, colon cancer screening after 50, screening for bone density, and lifetime lifestyle changes, such as wearing your seatbelt, not smoking, exercising on a regular basis, avoiding obesity. So focusing on one particular area, such as ovarian cancer, is important and essential, but shouldn't be lost for the big picture of care for a woman's health.